Hello, everyone. My name is Carmela Tartaglia. I'm a cognitive neurologist and scientist at Toronto Western Hospital and TAN Center for Research in Neurodegenerative Diseases. So a disease-modifying agent is really a medication that we think will alter the course of a disease. And so when we think of medications, we think of two broad categories. We think of medications that are symptomatic. So a medication that will make you feel better, can improve your symptoms, but actually does not alter the course of the illness. So if the illness is going to progress at a certain rate over the years, then the rate stays the same, but you might feel better as the disease progresses. Disease modifying, on the other hand, is something that we all want. And when people think of disease modifying, the ultimate examples are cancer drugs, right? Where they actually can cure you or keep you alive for many years. But there are many disease modifying agents. So when people think of Crohn's disease or lupus, many of these inflammatory conditions, you can't cure the person while they have the disease, and the disease is with them forever, but you can alter the course of that illness. So in Alzheimer's disease, we now have medications that are thought to be disease modifying, which means changing the course of their illness, changing the progression of the disease. That isn't to say that we now have disease modifying medications that cure the disease. We're not there yet. I think it's important to mention that Alzheimer's disease is only one of the causes of dementia. So at this time, the medications that are approved by the Federal Drug Administration in the United States and under Health Canada review are targeting Alzheimer's disease. They are not for other causes of dementia, which include, Parkinson's disease or frontotemporal dementia or normal pressure hydrocephalus. These are drugs aimed at Alzheimer's disease. So right now, we only have disease-modifying agents that are targeting one of the abnormal proteins in Alzheimer's disease. So in Alzheimer's, there are two abnormal proteins. There is the buildup of amyloid, and it takes the form of amyloid plaques. And there are neurofibrillary tangles made up of tau. So you've got these two abnormal proteins building up in the brain. And the disease-modifying medications that are currently either approved in the United States or under Health Canada review are medications that are aimed at removing the amyloid part of the disease and trying to get it out of the brain. Now, it's important to note that amyloid is not the abnormal protein that is associated most with cognition. That is the tau. But we do feel that if you can get amyloid out of the brain, that it will, as a consequence, allow the tau to decrease in accumulation. So there is some evidence that removing amyloid will have an impact on tau, and the tau is what seems to dictate most how well or badly people do. So in terms of thinking about the future of disease modification in Alzheimer's disease, one would probably envision medications that might target both of the abnormal proteins. So you could think of, what we do in cancer care, where there's a lot of combination therapies. So one of the therapies would attack amyloid and the other therapy would attack tau. Now, it's important to remember that these abnormal proteins are building up decades before we show any signs of disease. And so we could think of maybe there's ways of attacking these pathways at earlier stages. So people are looking at other disease-modifying approaches that don't even involve taking out amyloid or tau, but maybe can change the course of the illness by attacking something upstream of when the amyloid and tau are actually being deposited.